Diabetes mellitus is a chronic disease caused by the inability of the pancreas to produce sufficient insulin, or the body's inability to use insulin effectively. Let's see better what it's about in today's video. Hello and welcome to Med4Care. Today's topic is diabetes mellitus. The term diabetes mellitus does not refer to a single pathology, but to a group of metabolic disorders united by the clinical data of hyperglycemia. By hyperglycemia we mean an increased level of glucose in the blood caused by reduced or absent insulin production. Chronic hyperglycemia causes long-term damage to various organs and systems, among which the most affected are the eye, the kidney, the peripheral nervous system and the cardiovascular system. Who can we turn to treat this pathology? The reference specialist is the diabetologist endocrinologist. In recent decades there has been a marked increase in the prevalence of diabetes mellitus throughout the world and, according to studies, it will tend to increase further. Globally, approximately 1 in 11 adults have diabetes mellitus. It is important to know that there are two main categories of diabetes, namely type 1 and type 2. As regards type 1 diabetes mellitus, studies have shown a higher prevalence in Scandinavians and Sardinians. Type 2 diabetes, which is also the most common, is more widespread in other ethnic groups, such as American Indians, Hispanics and Asians. Type 1 diabetes mellitus is characterized by an absolute deficit in insulin production. It typically manifests itself in childhood or adolescence. Type 2 diabetes mellitus accounts for approximately 90% of cases. At the basis of this form there is a combination of tissue resistance to insulin and inadequate insulin secretion by pancreatic cells. This form of diabetes is associated with a strong genetic predisposition. It is more frequent in adults and is associated with other metabolic alterations such as obesity. In recent years, consistently with the increase in childhood obesity, it is also becoming increasingly frequent among children. The signs and symptoms of diabetes mellitus are related to chronic hyperglycemia and are glycosuria, an increase in urinary glucose excretion, polyuria, an increase in urine production, pollachiuria, an increase in the frequency of urination, polydipsia, an increased sense of thirst, resulting in increased fluid intake, polyphagia, an increased sense of hunger, dehydration, nausea and vomit, visual disturbances, increased susceptibility to bacterial and fungal infection. Regarding the diagnosis, clinical suspicion generally emerges when typical symptoms appear or due to an altered laboratory test. The general practitioner refers the patient to the endocrinologist for a specialist evaluation. The medical history in subjects with suspected diabetes generally naturally includes the collection of information regarding the patient's personal and family medical history, current symptoms and lifestyle. Some specific questions concern the presence of symptoms such as increased thirst, hunger, urination, unintentional weight loss, blurred vision or tired vision, frequent infections, fatigue or weakness. Other risk factors are family history, obesity and sedentary lifestyle. The physical examination in subjects with suspected diabetes generally includes a general evaluation of the patient and the measurement of some specific parameters. Weight, height and body mass index, BMI, blood pressure, heart and respiratory rate, evaluation of the skin and extremity skin, looking for possible signs of neuropathy, such as dryness, calluses, or ulcers, evaluation of the abdomen, looking for possible signs of obesity, such as increased waist circumference, eye exam, looking for possible signs of retinopathy, basal fasting blood glucose. It is important to know that the blood sample must be performed after fasting for 8 to 12 hours. There are acute complications of diabetes mellitus such as diabetic ketoacidosis. The triggering causes are represented by serious intercurrent illnesses such as heart attack and stroke. The manifestations are nausea, vomiting, abdominal pain, but in 5% of cases these acute complications can cause cerebral edema, coma and death. Diabetes mellitus can also lead to chronic complications. In fact, chronic and poorly controlled hyperglycemia over time can cause multiple complications affecting different organs and systems. We have microangiopathic complications such as diabetic retinopathy, which is one of the main causes of blindness in Western countries, diabetic nephropathy, which is the leading cause of chronic kidney disease in industrialized countries, diabetic neuropathy, which typically affects the hands and feet and presents with alterations in sensitivity. Then we have macrovascular complications. They are the result of damage to medium and large caliber vessels. At the base there is a process of accelerated atherosclerosis. The main ones are angina pectoris and acute myocardial infarction. Let us remember that myocardial infarction is 3 to 5 times more frequent in patients. Transient ischemic attack and stroke. All patients with diabetes mellitus must undergo periodic screening to evaluate the onset of complications. For type 1 diabetes, this is carried out starting 5 years after diagnosis, while for type 2 already from the moment of diagnosis. The assessments mainly include foot exam, eye examination with examination of the fundus of the eye, evaluation of renal function, evaluation of the lipid profile and control of blood pressure. Diabetes treatment is based on lifestyle changes and the use of medications. For the prevention of chronic complications, the correct therapeutic management of conditions frequently associated with diabetes, such as hypertension and obesity, is also very important. Furthermore, it is essential that all diabetic patients are well aware of dietary restrictions and how to self-monitor blood sugar. In addition to the periodic checks prescribed by the doctor, in fact, blood sugar levels are monitored directly by the patient, 1 or more times a day depending on needs, using various devices, the most used of which is the glucometer or reflectometer. It is a simple-to-use medical device, which allows you to estimate the concentration of glucose in the blood through the analysis of a blood sample taken using specific Lancing devices. The sample is then collected on test strips that are inserted into the device. The values are noted in a glycemic diary kept by the patient, which must then be examined by the doctor during the visit. All patients with diabetes mellitus should maintain a diet low in saturated fatty acids and cholesterol, containing reduced amounts of carbohydrates. Nutritional advice can be very useful. In type 2 diabetes, weight loss and calorie restriction are of great importance. Another important precaution concerns foot control. The aim is to identify any wound or ulcer early and intervene promptly. Feet should be washed daily with water and neutral soap and dried gently. Nails should be cut carefully, possibly with the help of a podiatrist. Footwear must be comfortable, wide and breathable, and walking barefoot is not recommended. Additionally, diabetic patients should be vaccinated against Streptococcus pneumoniae and the influenza virus. Deltoid, abdomen and thighs. The main drug for those suffering from diabetes is insulin. It is necessary in all patients with type 1 diabetes mellitus and in some affected by type 2. It is generally administered subcutaneously, via syringes or pen devices, directly by the patient by periodically rotating the injection sites, for example deltoid, abdomen and thighs. The most used administration scheme consists of the administration of long-acting basal insulin, once a day, in combination with rapid, short-acting insulin, with the 3 main meals. Alternatively, there are portable microinfusions capable of releasing predetermined quantities of insulin automatically under the skin. The most frequent complication of insulin treatment is hypoglycemia, i.e. the excessive reduction in blood glucose values. Patients are educated to recognize the symptoms and to quickly consume sugar in the form of sweets, fruit juice or sugar cubes. The symptoms we are talking about are headache, blurred vision, sweating, palpitations and confusion. In conclusion, diabetes mellitus is a chronic disease with progressive evolution, whose diffusion is constantly increasing throughout the world. It requires complex long-term management and active participation of the patient in the therapeutic process in order to prevent chronic complications and ensure the maintenance of a good quality of life. We have now reached the end of today's video. We hope you liked it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video of ours comes out. See you soon on Med4Care.